This Chat with the Experts is brought to you by Angie's List on 93 WIBC.
Welcome back to Chat with the Experts, brought to you by Angie's List. We're here today with Dr. Scott Renshaw, Value Health, and we've spent the first part of the show today talking about preventative health and what you can do to keep you and your family healthy. We've talked about some of the screenings and things I should be expecting when I come into the doctor's office, but Dr. Renshaw, as we're approaching cold and flu season, kids are back to school, what are some things I can be doing on my own to ensure that I stay healthy through the coming season?
Sure. Well, obviously, flu shots, 'tis the season. Keeping your hands washed, hand sanitizer can be your best friend this time of year. Lots of people touch doorknobs and bathroom fixtures, and so keeping your hands clean. Obviously, eating healthy and exercising. You hear that a lot, but it goes a long way.
Yeah, no question about it.
Sure.
And bringing up flu shots, is that something I feel like I know myself, there's been years where I've gotten a flu shot, years where I didn't. Is there a right way to go about that? Is it something you need to be doing every year to really get the full benefit of it?
Correct. You should do it every year because every year it's a different strain. So the people that manufacture these things kind of predict what strain is coming. So it depends on what the prediction is what is in that flu vaccine that year. So so it doesn't last more than a year. You're protected for that year, but then the following year that strain might not be here, so you're not protected anymore. Right.
And now I know when these things happening, there's like a month straight where everywhere you go, there's places offering a flu shot. Is there a right? Should you go to your doctor for that, or can you go to somewhere like just a pharmacy or a health clinic and get the flu shot?
Probably other doctors will say different. I'm of the type, if you get it anywhere, that's fine. Just let me know you have it so we can get on your record so we know. But other people might say, oh my goodness, you have to come to my office and here's the time to do it. So it's probably a little bit doctor dependent.
Yeah, definitely. One of the things as we talk about preventive service, there's a lot of people out there that don't take advantage of it. I know I've been guilty of that in the past. What do you think is the main reason why people aren't getting these sorts of services and dealing with these things up front? Yeah,
well, kind of like as we spoke about preventative services, there's nothing bothering you, right? Like you don't know that you need to be worried about condition X. So why do I want to take off from work and why do I want to do that and spend a half day waiting for the doctor who's running behind anyway and looking at magazines that are a year old in the waiting room, those kind of things. Sure. So I think people it just doesn't hit your radar screen. It's not bothering you now, and I need to worry about today because I got to get dinner on the table and get to the grocery store and get the kids off to basketball practice. Who has time to worry about the potentially fact that I might possibly have high blood pressure? You know? So I just think it's a time factor a lot of times.
Yeah, it's always one of those things. Once it does hit and it does happen, you're thinking, "Gosh, why didn't I go get that checked out?"
Hindsight is always 20/20.
Yeah, right. Absolutely. I want to switch topics here for just a little bit and talk about another health issue that concerns quite a few, and that's stress. This is going to be, we're kind of shifting the conversation here, but I want to start off by asking you for, we know some of the basic things, but what, in your opinion, what are some of the early signs of stress that it might not be just the normal daily stress, but something that could potentially be harmful in the long run?
Sure. Everybody manifests stress a little bit differently. Usually, I think some of the more common signs are a headache every day, not sleeping very well. Maybe you're eating more than you typically would because you're quote unquote a stress eater. Or some people, when they get stressed, they kind of don't eat. So I think a lot of the kind of the physical signs that we just sort of attribute to, oh, I'm a little stressed out today, or sometimes it's not a little stressed out. It's actually a big deal.
Yeah. And a lot of times this can even happen without you even realizing exactly what you're going through or processing what's going on around you. Do you see, common signs of stress, that people should be looking for? Or?
Again, I think a lot of times asking people around you is probably a good idea. Sometimes other people can tell you that. Again, headache is a common one. Sometimes people kind of quote unquote carry their stress in their stomach, so they kind of feel nauseated a little bit, just not eating very much, sleeping troubles, those kind of things.
So you can start to feel as though this is just, kind of a part of everyday life. We've all had a stressful week or something. Why is it problematic if you're noticing this as kind of a continuing trend? Sure.
Well, we're all a little bit different, but stress just wears you out. It weakens your immune system. Most people will notice in the winter when you get stressed out, you're more likely to get a cold, and there's medical evidence to back that up. Our immune system gets weak under stress. We don't sleep as well. We just become unhealthy.
Yeah, so I guess, it's obviously pretty clear then that there's a direct correlation between stress and especially a chronic enduring stress and then illness.
Oh, sure, of course, yep.
So how do you see some of these things manifest themselves in kids or teens? Is it different than it is for an adult if you're dealing with stress?
Oh, sure. A lot of times in kids and teens, it's school problems where they weren't having school problems before, but now they are. Kids used to do their homework pretty well when they got home. Now they're kind of resistant to doing homework or staying on task or focused. Just going into the bedroom and sleeping a lot or not interacting with the family at dinner time, those kind of things.
Do you feel like some of the stress in children can be maybe more easily dismissed by the parents of like, oh, they're just going through a phase? Or
they're teenagers, right? Yeah, that's what we say. And it might not be that, right?
Yeah. It's good to, if you're seeing a pattern there to kind of follow up on it and talk with your doctor about it. How can you evaluate your stress to find out if this is something that, isn't just going to go away, but you need some help?
Yeah. That's tough. I'm sure there are probably some online little quizzes you could take that would give you a rating. But I think if you're starting to see some of these some of these signs and symptoms, and it's becoming a repetitive pattern, it's probably time to seek some help someplace else, whether that be a counselor, your physician. A lot of jobs have employee assistance programs, which is kind of a confidential counseling short-term thing just to kind of gauge the level of the problem, so to speak. So there's lots of things you can do. Sure.
Are there some common stress relief practices that you can do on your own? Maybe you've already taken the first steps and, getting some help or speaking with somebody. What can you kind of be doing in your own time as the days go by to kind of work through some of it?
Sure. Well, we're all different on this, but I think a lot of folks have found deep breathing, kind of meditating type exercises and being very mindful is very helpful. A lot of times I tell my patients to, this is going to sound weird, but you kind of have to practice. Like to be good at basketball, you have to practice, right? To be good at dealing with stress, you kind of have to practice.
Yeah.
So it's not just going to happen. You're not going to magically be really good at handling your stress. So I think being mindful about it and practicing that, and maybe today's the day you only focus on one stress. So today's the money stress day. Everything else I'm not going to worry about. So then it doesn't feel as big because it's only one thing you're stressing about versus all 14 things or something.
Yeah.
So, and we're all different. Everybody has their own little tricks and ways to cope.
Yeah, definitely. And that's kind of the important part of, speaking with somebody and kind of working through it to get an understanding of what's going to be best for you as an individual to work through some of that. So let's say I go to my family doctor, I'm noticing some early signs, or maybe my kid is, as the family doctor, is your role to kind of help direct them to somebody, or maybe like get them to a specialist that's going to be able to address some of that, or how does that process
Sure,
work?
both. In my training, I do have some training in counseling. So, kind of some simple counseling, talking through some things. A lot of family docs can do that. Some docs would also refer to the local, like employee assistance program or mental health professional, psychologist, something like that as well. So either or.
Yeah.
And
I imagine another big part of this is, as we talked about before when you came on earlier this year, about developing that rapport and that relationship with the doctor. I mean, we talk about it with every profession, whether we're on the show talking about hiring a roofer, have that relationship with your plumber. With your doctor, it's like a whole nother level. And especially I think when you're dealing with an issue like this, having that relationship where your doctor kind of has a feel for who you are a little bit and, and your own health, I imagine that would help immensely. And as I come in to talk with you to deal with some of this.
Oh, sure. Exactly. Once you kind of get to know somebody and you sort of, maybe you only see someone once a year for their annual physical, and all of a sudden now they're coming in with headache. That's new. Why is this otherwise every year healthy person coming with a headache? So then you start asking questions, or, maybe it's their heartburn is getting worse, or, whatever the case may be. But yeah, getting to know your doctor and the doctor getting to know you and your family can be very important.
Yeah. That kind of brings up an interesting thing I wanted to ask you, just because, there's people that might come in once a year for the annual checkup, but if in a situation like this, do you enjoy that part of kind of knowing a patient well enough that you're able to kind of spot some of these things and, lead them to treatment in that way, as opposed to somebody that's just kind of like showing up randomly once every year or so to get their screening?
Sure. Yeah. Part of the fun of my job is getting to know people and their families and knowing that they have chickens or don't have chickens or a dog or whatever the case may be. That's part of the fun. Sure.
Yeah, sure. That's excellent. Well, it is time for another break here, but don't stress out. When we return, we're going to take your listener questions and get you some answers from Dr. Scott Renshaw. We're also going to take a look at what's trending and get you some more information for dealing with stress and how to manage stress in your daily life. Keep it right here. You're listening to Chat with the Experts, brought to you by Angie's List.
Do you love a good bargain? Angie'sList.com showcases popular deals from highly rated local companies so you can save time and money on the home and health services you need most. Remodeling your kitchen? Painting your house? Cleaning your carpet? We've got a deal for that. Angie's List members even have access to exclusive discounts, up to 80%. Don't waste another day or another dollar. Start shopping now at Angie'sList.com.